Obesity is known to be associated with an increased risk of developing prostate cancer. It is also known to be associated with more aggressive, metastatic, and drug-resistant cancers. As adipose tissue grows in mass, the microvasculature is unable to adequately perfuse the tissue, leading to localized pockets of hypoxia and inflammation. The chronic pro-inflammatory state of obese adipose tissue induces dysfunction in microvascular endothelial cells. We have shown in previous work that adipose microvasculature in this pro-inflammatory environment is leaky and less angiogenic, and the microvascular endothelial cells have features of mesenchymal transformation. Extracellular vesicles produced by these endothelial cells carry the pro-inflammatory signature of the parent cell in their proteome and can cause dysfunction in recipient naive cells. TWIST1 is an oncogene that is known to be upregulated in both prostate cancer and obesity. Its expression in prostate cancer is positively correlated with tumor Gleason score and metastasis. TWIST1 is required for epithelial to mesenchymal transition, which enables tumor cells to transition between epithelial and mesenchymal states, permitting it to adjust its capabilities to better suit a less proliferative, more invasive state during metastasis, or a more proliferative, less invasive state when colonizing a secondary tumor site. To explore the link between obesity and prostate cancer aggressiveness, we employed vesicles obtained from either human subjects or generated in vitro. Human adipose extracellular vesicles were isolated from adipose tissue obtained from patients undergoing bariatric surgery. These will be referred to as ATEV. To mimic the pro-inflammatory obese environment in vitro, we cultured human adipose microvascular endothelial cells in the presence of pro-inflammatory cytokines and isolated vesicles from the conditioned media. These will be referred to as EV-PIC. Isolated vesicles were then incubated overnight with PC3ML prostate cancer cells. To model varying stages of cancer progression, PC3ML engineered to express either deficient or surplus endogenous TWIST1 were also employed. Analysis of both ATEV and EV-PIC cargo revealed a shared subset of microRNAs targeting key biological processes associated with cancer progression. In the lower left corner of the slide, you can see that IPA analysis of the mRNA transcriptome of PC3ML treated with either ATEV on the left or EV-PIC on the right revealed a striking similarity in the pattern of activation or inhibition of pathways mediating cancer progression. On the right-hand side of the slide, you can see that both ATEV and EV-PIC increased proliferation and reduced invasion in treated PC3ML. When we explored the consequences of deficient or surplus TWIST1 in PC3ML, we found that, as you can see on the left-hand side, reducing endogenous TWIST1 reduced the proliferative capacity of PC3ML, while surplus TWIST1 increased it. Interestingly, elevated TWIST1 also increased the invasive capacity of PC3ML. On the left-hand side is data indicating the effect of EV-PIC treatment of PC3ML in the presence of increased endogenous TWIST1. EV-PIC plus increased TWIST1 enhanced the proliferative capacity of PC3ML and reduced invasion. IPA analysis of the mRNA transcriptome of EV-PIC-treated PC3ML expressing either wild-type levels of TWIST1 on the left or increased TWIST1 on the right revealed a striking increase in the activation of pathways mediating cancer progression. Taken together, these data tell us that extracellular vesicles from both adipose tissue and adipose microvasculature contain a shared subset of microRNAs that are capable of exerting similar effects on recipient PC3ML mRNA transcriptome. Both ATEV and EV-PIC increased proliferation and reduced invasion, which may indicate a tendency towards a more epithelial cell type that more readily colonizes a secondary tumor site. Overexpression of TWIST1 alone increased proliferation and invasion, but treatment with EV-PIC in the presence of increased endogenous TWIST1 increased proliferation but reduced invasion. This suggests that TWIST1 may support phenotypic flexibility, allowing the tumor cell to adapt to environmental cues supporting either metastasis or colonization. Thank you for viewing my presentation. I look forward to your questions and would like to extend a special thank you to Dr. Wellman, Ms. Marianne Clements, and the biorepository staff for their contribution to the generation of our nanostring transcriptome data.